Hi, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. I want to cover a major advance in preventive cardiology, the LipoMed blood test profile. Historically, we first realized in 1972 that in general, the higher the level of blood cholesterol, the higher the risk of heart attack and stroke. Unfortunately, there were lots of people who had high cholesterol levels and lived to a ripe old age, and others who died of heart attacks or strokes that had relatively low cholesterol levels. In 1975, we learned about the HDL, or the good cholesterol. HDL cholesterol is the body's natural cholesterol removal system. We found that many of the people that had high cholesterol levels and lived to a ripe old age had high HDL cholesterol levels. We also found that many of the people who had heart attacks and low cholesterol levels had very low HDL cholesterol levels. So we viewed the development of cholesterol blockages in the arteries as being a dynamic balance between the bad cholesterols, called LDL and VLDL cholesterol, and the good HDL cholesterol. The bad VLDL and LDL cholesterol are constantly being deposited into the walls of the arteries feeding our body, while the good HDL cholesterol at the same time is removing the cholesterol from the walls of the arteries. The HDL cholesterol is taken back to the liver for safe removal in the stool. The ratio of total cholesterol to HDL cholesterol was found to be a much better predictor of who will develop heart disease and stroke than measuring only total cholesterol or HDL cholesterol. Unfortunately, there are people who have relatively low total cholesterol to HDL cholesterol ratios who develop heart attacks, and others with high ratios that do not develop heart attacks. The latest advancement in preventive cardiology is the LipoMed profile. Before we cover the LipoMed profile, let's go over normal cholesterol metabolism in the blood. There are two sources of cholesterol in our bodies. One comes from cholesterol in the diet, and the other is cholesterol that is made in the liver. The cholesterol that is in our diet goes directly from our stomach and intestine to the liver for processing. In the liver, the dietary cholesterol is combined with the cholesterol and triglycerides that are made in the liver. The cholesterol and triglycerides are put into the blood in a particle called Vldl. The size of the Vldl particle is really important. Large Vldl particles are very dangerous and can get stuck in the walls of the arteries. Smaller VLDL particles do not get stuck in the walls of the arteries and are processed into LDL particles. Hence, a person with the same amount of cholesterol and triglycerides in VLDL particles can either be at risk for artery blockage or not, depending on the size of the VLDL particles. Just like VLDL cholesterol, there are good and bad LDL particles. Some LDL particles are very small and very sticky. That is, they really build up in the walls of the arteries feeding our bodies and cause blockages. Other LDL particles are large and are not sticky. They are removed by the liver before they can cause any blockage. The difference between the amount of good LDL, good VLDL, bad VLDL, and bad LDL can really affect the risk of getting heart disease. People with the same amount of LDL and VLDL cholesterol can have a totally different risk of developing heart disease depending on the amount of good and bad LDL and VLDL. As I said earlier, HDL cholesterol is our body's natural cholesterol removal system. The higher the HDL in general, the lower the risk. There are, however, two types of HDL. One type of HDL is large and is very active in removing cholesterol from the blockages in the arteries and taking it back to the liver for safe disposal into the stool. The other type of HDL cholesterol, which is small, removes the cholesterol from the artery blockages, but instead of taking it back to the liver for safe removal in the stool, it actually takes the cholesterol back to the VLDL and LDL particles that are very sticky and back into the artery blockages. People that have high amounts of HDL but who have low amounts of the good active HDL cholesterol and high amounts of the inactive HDL cholesterol can develop significant artery blockage with good HDL levels. The highest risk person is a person who has a lot of bad VLDL, bad LDL, and very little good HDL. As you can see, there are people with the same total cholesterol, LDL cholesterol, VLDL cholesterol levels, and ratios who are at high risk for developing heart disease, and some who are at low risk depending on the amount of good and bad LDL, VLDL, and HDL cholesterol. Fortunately, we have specific therapy that can reduce the amount of the bad LDL and VLDL and change the LDL and VLDL from the bad forms to less harmful forms. In addition, we have therapy that can increase HDL cholesterol and convert it from ineffective HDL to good HDL. I think it is very important for every patient with established cardiovascular disease or who is at risk for cardiovascular disease to have a LipoMed profile performed to be certain that they have been adequately treated to prevent future heart attacks and strokes. The LipoMed profile accurately determines the good and bad VLDL, LDL, and HDL cholesterols. I hope that this educational video has helped you better understand this new test and why I may recommend additional cholesterol medications even when your ratio LDL, VLDL, and HDL cholesterol levels look good. I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas.